All right, folks, thank you so much, and thank you for tuning to our channel and being members of this channel for the last 20 years. And some of you are still watching these videos. And recently, I started a new website, supertestscores.com. Supertestscores.com. If you are preparing for your medical boards or USMLE, or any other medical test, this website is for you. All right. Because I am posting very, very important information on this website. So please check this website, supertestscores.com. And in today's video, I would like to talk about Jarisch-Herxheimer reaction. Basically, this is a transient clinical phenomenon that occurs in patients infected by spirochetes who undergo antibiotic treatments. Basically, you have a syphilis patient, even though historically this is about syphilis, you see this in association with syphilis. There are other diseases like Lyme disease, leptospirosis. Any spirochetal disease can cause Jarisch-Herxheimer reaction. It usually starts like in 2 hours after you give antibiotic treatments. The exact mechanism is still unknown, but most scholars believe that once you start taking the antibiotic, as the spirochetes get killed, the polysaccharides or lipoproteins from their bodies are released into the bloodstream, and they start an inflammatory process which causes the reaction. So you got a syphilis patient, you started them on penicillin, and they start all kinds of symptoms, an abrupt onset of fever. The temperature can start like 100 and it can go to 107.2. Okay, 100. Think about that. 107.2 temperature. People will have myalgia, chills, and shortness of breath, and they can't walk, they can't breathe well, and they feel terrible. And imagine if the patient is a pregnant woman, she would go into so much distress. Even her fetus can go into so much distress. Sometimes they might even have preterm labor. So, this is a serious reaction, and some people get horrified when this happens. But the good news is it is a self limiting condition. And most people, they get better in 24 hours. And you don't even have to do a lot for them. You just need to support them. You need to educate them. You have to tell them, because it happens when they take penicillin. Some people say, oh, now I got a reaction to penicillin. I'm allergic to penicillin. You need to tell them this is not an allergy to penicillin. Okay. Jarisch-Herxheimer reaction is not due to penicillin allergy. It is a completely different process. So again, correlation is not the causation. Okay, you took penicillin and Jarisch-Herxheimer reaction happened. But penicillin did not cause this. These are two independent things. So do not stop taking penicillin because you got Jarisch-Herxheimer reaction. Just hold on. And most people just develop mild attacks of this reaction. All they need to do is to take some ibuprofen or Tylenol, drink fluids, take rest, then that will be fine. And if they are pregnant and if they are going through more serious things like variable decelerations, fatal distress, then they need more care. But most of us are not pregnant. So for most of us, we don't have to do much. So Jarisch-Herxheimer reaction is basically what happens when the spirochetes get killed by penicillin and they develop abrupt onset of different symptoms like fever, chills, myalgia. and you don't need to do any labs because there is no specific test to diagnose this condition. It is a diagnosis of exclusion. You need to think about what caused this, what caused this. Did penicillin allergy cause this? Something else happened. Then when you say, oh, this is because I started penicillin, this happened. Remember, this is not a rare condition. 60 to 70% with secondary syphilis can get this, right? That's a lot of people, folks. 60 to 70% can get this condition. So when you see this condition, you make that clinical diagnosis and you reassure patient to continue to take their antibiotic, because if they don't take penicillin, their syphilis will not leave them. So syphilis is a very dangerous disease. It can go into brain and can cause neurosyphilis. And some people can develop dementia and neuropsychiatric problems from syphilis. So, and penicillin is still the wonderful best drug available to treat syphilis. So people should take it in spite of developing Jarisch-Herxheimer reactions. So those are my few little words about this important reaction. This is a very, very important thing. It will be tested in your exam. That's why I am emphasizing this. Please visit our website, supertestscores.com, and we are also going to put a question bank for all of you, and it will come soon. So please look forward to that and subscribe to our channel, and I will see you in the next video.